Thank you. Thank you, sir.
The floor is yours.
Well, you'd like me to speak a little about the topics you introduced? Certainly. So, as you said, in the United States, dying of a heart attack and other cardiovascular diseases is unfortunately still number one, is the overall cause of death, second to cancer. And I might point out, number three is dying of medical errors, which is quite a shocking statistic, that number three is dying of medical errors, which is why you want to take extremely good care of your health, so you don't have to depend on having medical procedures where errors might happen. In Canada, I understand cancer has somewhat surpassed heart disease as a cause of death, just slightly. In fact, it was predicted that in the United States, cancer would overcome heart disease and become the number one cause of death, because you talk about all the advancements that have occurred in the cardiovascular field, and there's many, but we still are dealing with it as the top cause of death. And the sad part of it is, if we focus predominantly on heart attack, stroke, atherosclerosis, it's largely possible to both prevent the disease and to identify it very early and attempt to reverse it years before it becomes a serious problem. But we don't have a paradigm in medicine that says we should attack heart disease like we attack a war on drugs or some other, global focus of a societal mission. There have been such foci. For example, I'll just point out, in the country of Finland, in the late 60s and the early 70s, heart disease was also, and I apologize if you hear a couple dogs in the background. Somebody's picking up one dog that I'm housing, so I apologize for a little background noise. But in the 1960s and 70s in Finland, heart disease was the number one cause of death by far compared to everything else in the country of Finland. And they decided to get a effort together to lower the risk of heart disease. And they put up educational pieces at work, grocery stores, post offices. And they advised the public, particularly young men, don't smoke, reduce your animal saturated fats like butter and cheese, increase your fruits and vegetables. And those simple instructions within 5 years dropped the risk of heart attack by 85%. And that was started in a small corner of Finland called North Karelia. And then it was expanded after 5 years to the entire country. And the entire country experienced a significant drop in heart death and heart attacks in the range of 80%. So we don't have to ask the question, is it possible to reduce dramatically heart attacks and heart attack death? We know it can happen, but it took a whole country and a whole government and a whole health division to focus on one important topic, which was to bring an end to heart disease. I just want to see if we're still together.
Yes.
Yes? Good. I know technology is a little bit tough tonight, but that's okay. I just want to make sure we're still there. So indeed, the lessons of Finland and North Karelia in the early 70s, which have been published and continue to have a dramatic drop, should inspire us to say, then why do people drop dead? So you correctly identified the second book I wrote is called Dead Execs Don't Get Bonuses. It's a strategy to alarm the public of the risk of heart disease, and then the strategy how to identify heart disease early, and even more important, to prevent the disease in the first place. Although that book was published a few years ago, and I just mentioned we learned lessons in Finland 40 years ago. Just 3 weeks ago, very sadly, a gentleman who was CEO of the Intel Corporation, one of the largest technology corporations worldwide, who had just retired a couple years before, Paul Otellini, one of the leading executives in the world, dropped dead suddenly of a heart attack at age 66. So we have not eliminated the problem. And seemingly even access to probably excellent medical care with no particular, concern for the cost of that medical care still does not prevent people from dying, whether they're executives, whether they're firemen, whether they're school teachers, whether they're our friends and family. So we've got a lot to do, and this has fired me up because we know we can reduce it. For example, I talked about Finland, and that was studies in the 1970s, early 1970s. Dramatic reduction in heart attack deaths by changing the diet away from animal saturated fat. A lot of discussion about butter is back. Go talk to the people of Finland. Ask them if they enjoyed a health improvement by eliminating animal saturated fats. They'll say yes, it's published. It's not theory, it's proven science. But we can fast forward that to the last few years in Europe, where there have been studies of following up populations of tens of thousands of people and identifying at the beginning and 20 years later a group of people who had no heart disease and 20 years later who had experienced a heart attack or a heart death. And there, in fact, are 6 things that anybody can do that can lower, on average, their risk of having a heart attack by about 85%. That's a similar number to what they did in Finland, but these are different studies throughout Europe, Sweden, and the Netherlands. So what are the 6 steps anybody today can start doing to lower their risk of heart attack by 85%? So one won't surprise anybody. One is to quit smoking. If you're a smoker, you're going to double, triple, quadruple your risk of heart attack. So you need to quit smoking immediately and stay off smoking forever. Number 2, you need to walk. And in these studies, walking 30 to 40 minutes a day was one of the independent factors to lower your risk of heart attack by dramatic amounts. Now, you want to do more than walk, although I wouldn't suggest you run many marathons because ultra exercise may in and of itself be somewhat stressful on the cardiovascular system and the heart particularly. Number 3, people had thin waistlines and they did not have central or visceral obesity. So be proud if you can wear the same pants you wore when you graduated high school. And if not, work hard to get there in a healthy fashion. I personally emphasize using fasting diets to get your weight back to proper level because they work so well and they can be maintained long-term. Plant-based fasting diets is what I use in my clinic. Number 4 is to sleep 7 hours at night. A relatively new finding that if you sleep less than 5 hours a night, you increase your risk of heart artery blockage and heart attack. Number 5 is to actually enjoy a little bit of vino now and then. That comes out in these studies from Europe, but not to overdo it. This happens to be, I'll mention a wine from Sardinia, Italy called Renown, which may be one of the highest antioxidant wines in the world and quite inexpensive. And number 6, finally from Europe, you want to lower your risk of heart attack, you eat 5 or more servings of fruits and vegetables a day. Whether you like it, whether you don't, you eat 5 or more servings of fruits and vegetables a day. If you can't stand fruits and vegetables, you get a blender, you put them in a blender, you throw in some almond milk, some cinnamon, some nutmeg, you turn it on, and it tastes like a beautiful, delicious fruit smoothie. And if you like fruits and vegetables, then eat them for breakfast, lunch, and dinner as your snack. So those are the 6 steps that science says. We learned the first lessons in Finland. We learned further lessons in the last 3-4 years throughout Europe in tens of thousands of people. Finland was an entire country. These other studies were individual cities like Stockholm. And we can prevent heart attacks. Now, we can even do better than that, but we talked about simple lifestyle measures that reduce your risk of heart attack. What I mean by we can do more than that is there are lab tests that everybody should know their blood pressure. Everybody should know their blood sugar and their 3-month blood sugar called their hemoglobin A1C. Everybody should know their cholesterol panel, and then I believe they should know their advanced cholesterol panel, something widely available. And I think everybody should know their homocysteine level and their lipoprotein A level, a genetic type of cholesterol that can be measured for a few dollars, and that it affects, in the United States, 20% of the adult population, 63 million Americans, have an elevated form of cholesterol that causes atherosclerosis, heart attack, and stroke, and nobody checks for it, which is unfortunate. And then we can do better for it by actually searching for early silent atherosclerosis. You know, anybody who's listening who's ever met a pregnant woman or been a pregnant woman, you might have found out when you were 2 months pregnant, but you were pregnant at 4 weeks too. Why do I say that? Because you don't want to find out you have heart disease when you have a heart attack. You don't want to find out you have heart disease the day you have a stent or drop dead or have a bypass. You want to find out when you're 4 weeks pregnant, way, 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 way early. And it's now possible doing ultrasounds of carotid arteries, a simple test called a CIMT, carotid intimal medial thickness ultrasound. Very simple test, very safe, unfortunately not widely available in United States or Canada. I do them in my clinic in Detroit, Michigan. A very simple test, and I learned so much. Then there's another study called a CAT scan of the heart, coronary artery calcium scan. And you can, in the United States, for as little as $50, sometimes $100, sometimes $120. But in Canada, I understand more like around $300. You can have a quick CAT scan of your heart at age 50 or 45. It involves no iodine, involves no IV, no pain, no discomfort, takes about 1 minute. And you can identify by having the CAT scan look at the arteries to your heart, whether you're walking around with silent heart artery calcification, clear-cut sign of disease, clear-cut sign of aging, clear-cut sign of a problem. And you can find out the equivalent of being 4 weeks pregnant. You can find out way before you're going to have potentially a heart attack or some other tragic and maybe even life-ending problem by a CAT scan that takes under a minute now. And I use all these modalities. The last thing I'll say, there are some other clues. So doctors are taught to ask the question, do you smoke? Do you have diabetes? Do you have high blood pressure? Do you have high cholesterol? Do you have a mom, dad, brother, sister that had a heart attack or stroke at a very young age? But there are some other clues. For example, if you lose the hair at the top of your head at an early age, that's recently been shown to be a clue that it's not perfect, but it may indicate some sort of aging process that also affects the heart. I'm nearly 60 years old, and I don't know why, but my hair is still pretty black. I've been eating a extremely healthy plant-based diet for about 4 decades. But it's been shown if you get salt and pepper grain early in life, it could be a clue, because that's oxidative stress, it's called, and you may have the same stress affecting arteries. If you walk and your legs hurt, that may be a clue that your heart arteries are clogged. If there's one more I want to tell you. If you have what's called erectile dysfunction. If a man 43, 44 years old is having problems with erections, it may be a clue they have clogged heart arteries and they should be checked, because that function of blood flow may be suffering before the heart suffers a few years later. And the last one is a very interesting one. If you look at my earlobes, which I don't normally show on Google Hangout, I don't have a line there, but there is a line some people have right there called a DELC, diagonal earlobe crease. And it was described 40 years ago. Yeah, a little bit like that if I fold my hair, but it would be more at an angle. It was described by a Dr. Frank 40 years ago. In his clinic, he suspected that was a clue to clogged heart arteries. It was published, it was forgotten, but in the last 3 or 4 years, there's been a number of very fancy studies saying if you have a deep crease in your earlobe, that may be as accurate as a stress test in identifying your heart arteries that are clogged. And there's actually even a theory why that's the case. So a diagonal, I look around and I'm an earlobe admirer. You have a nice smooth earlobe. I'm going to predict you, I'm not going to find heart disease on you. And when I see that line, I start to worry. I almost feel like I want to walk up to people in the grocery store and warn them, give them my card. So that's my little introduction. I want to see and make sure that you guys are hearing me okay. Is that true?
Yeah.
Yes.
Yep.
Yes. Then.
Very, very good. I don't know. I can go further if you have a question. You want me just to keep talking?
I may to start the discussion. Maybe would like to get your views on what should jurisdiction, like for example a province in Canada, like Quebec or Ontario, what could a jurisdiction, especially where you have public health available, you know, normally health is free for people, at least the consumption of it. What should a jurisdiction do ideally to prevent? Because my experience is that essentially very little is done right now.
Right. So I'm not a politician, but if I were in charge of the world, I would shut down cigarette companies and just eliminate them. So we've done a reasonably good job. Smoking rates in the United States used to be 40 to 50% of the public. Overall now it's about 15% to 18%. Sadly, the highest rate is in young people, 20 to 30. It's unfortunate. They should be smart enough to know the difference. But that's one thing I do. You know, we are obviously applying enormous taxes to cigarettes in the States, probably in Canada. But if we can't shut down the companies, let's tax them so high that essentially nobody could afford cigarettes. Number two, I would do the same for foods we know that are dangerous. And we know enough to say pastries, donuts, sweetened beverages like soda, and I would add processed meats. I would put a tax on bacon, hot dogs, sausage, so that they become very expensive. Take the profits and put them into a health fund and fund the development of preventive programs, because we know how powerful food is. And although we could debate it all day long, we know that you know, processed foods with excess saturated fat, sugar, refined flours are not healthy foods, and unfortunately they're often cheap foods. In the United States, it's absolutely crazy because a lot of these foods are cheaper. It's cheaper to buy a bacon burger than a salad because of government subsidies of dairy and meat and soy industries and stuff. So we, you know, if I were in charge, we'd stop subsidies to foods we know that are causing disease. And people have estimated that if a family of 4 went to McDonald's and there weren't government subsidies, it might be a $75 to $80 dinner. Well, a lot of people would stop going if it was $75 to $80 for a family instead of maybe $25. But there's so much government subsidy, it's crazy. So I would do that right away. I would actually put the subsidies where they should be. Subsidize the fruits and vegetables, 100% whole grains and the legumes, so that at least those foods are at fair price, or maybe they're actually at a reduced price, where we're going to see people turning to beans rather than beef. And there are now numerous studies that if people made one health decision, I'll eat beans rather than beef. I'll do bean stew, not beef stew. I'll do bean chili, not beef chili. I'll do bean burger, not beef burger. There would be both environmental, tremendous advance, and health, tremendous advance. Then I take all that money that we're spending on subsidies and the money we'll recoup from taxes on foods we know to be unhealthy. And we do know enough to say there's a group of foods that are unhealthy and should be taxed, and bacon is one of the top ones. But beyond that, I take that money and want to build sidewalks, want to build bike paths, want to build bike racks so you can ride your bike to work and lock it up easily, and want to make the right thing to do the easy thing to do. So I think we could, you know, if we could absolutely have total control over the legislature, and we couple everything with a public education program, we're not taking away your donut. You're just going to pay $10 a donut. So enjoy it if you want. but we're going to take 9 of the dollars and put them towards taking care of people who have obesity and diabetes related complication from donuts. And we're going to be fair about that, because otherwise citizens are paying for people that have either poor education or poor willpower or poor access to healthy food. So we'll use that money. That's what I do if I were the health czar.
Est-ce que je peux poser la prochaine question? C'est correct. Good evening, Dr. Kahn.
Hi, how are you?
Hi.
Bonsoir.
Bonsoir. Merci d'être là. Thank you to be here. Thank you so much.
Thank you.
for everything you do. My name is Julie Taillefer. I'm a registered dietitian. I'm vegan. My question for you, Dr. Kahn, concerns high-fat ketogenic diets.
Yeah.
Many trials studying those diets tend to show some improvement in some biochemical cardiovascular markers, HDL, triacylglycerols, sometimes even C-reactive protein, but it's only like maximum 2 year studies. So my question to you as an interventional cardiologist, what do we know about, and should we worry about long-term heart health because of those people following ketogenic diet, because these are markers, but these are not actual clinical outcomes. So I would love to hear you about this. So thanks again for your input.
Very good question. And you're right. Right now, you know, whether we call them ketogenic diets or low carb, high fat diets, some people eating meat-only diets are very trendy in our gyms, even amongst our medical professionals. There are startup companies, at least in the United States, that are using these diets to treat diabetic patients online with health coaches. So it seems like the world's gone mad because if you're eating a low-carb, high-fat diet, that means 100% whole grains. That means that legumes like beans, lentils, peas, and that means that maybe even fruit and vegetables are being limited, which are indeed the very foods that in almost all scientific studies in the blue zones and the Adventist Health Study and EPIC studies in Europe, all are the core of healthy diets, Mediterranean diets, which are clearly based on 100% whole grains, legumes, fruits and vegetables as, you know, core components. So I'm concerned. Now, what isn't mentioned, I don't even know that I've seen a 2-year biomarker study with a ketogenic diet. Most are 8 weeks, 12 weeks. You know, it's always a question, what was the diet that wasn't the ketogenic diet? In the United States, 65% of calories on average are actually junk calories from processed foods, hyper-processed foods, donuts, cookies, fast food through a window, carry out. And if you transition from what we call here a standard American diet or a Western diet, which is actually a death diet, and you transition to a diet that eliminates, that's the good news about ketogenic diets, they're going to eliminate calories like that, processed calories, and they're going to you know, replace them with real food, even if it's meat, even if it's bacon, even if it's you know, fatty content animal products, coconut oil. It's probably an improvement, and people will lose weight because there's actually some nutrition in some of those foods rather than the factory created processed, you know, frozen foods and gas station foods and cafeteria foods. And there's actually an improvement. So short term, the 6 to 8 to 12 week study, there may be weight loss, and accompanying that, some improvement in blood pressure, cholesterol, and measures of blood sugar. What concerns me is the long-term studies, which are not randomized, they're meta-analyses. There's at least 2 very, very large studies in the literature that say if you follow a ketogenic animal-based diet long-term, your risk of death goes up. And death is not a biomarker, death is death. Death is not your cholesterol. Death is the end of life, and you can't dance and go to parties and listen to Mick Jagger anymore. So death goes up. Now, they weren't randomized studies because we're not going to get 500,000 people that half agree to do a ketogenic diet and half agree to do a Mediterranean diet. and we follow them for 10 years. It's never going to happen. So we have to pay attention to these associations when they're powerful and they're duplicated in their large numbers. There's specifically a study from Harvard in 2014 that looked at only about 4,000 survivors of a heart attack who identified their diet. And those that identified after a heart attack, they were following a low carb, high fat, and indeed ketogenic diet, also had a much higher rate of death after a heart attack than those who identified their diets more akin to the Mediterranean diet. So I don't know as a cardiologist how I could possibly recommend an animal-based ketogenic diet to cardiovascular patients or even the general public when there is indeed no large study that says ketogenic diets lower death risk. Now, many will argue those two studies have flaws and their associations, they're not proven causations, but that's true of almost all nutritional data that's of large size. They're associations, and that's what we got to deal with because of the difficulty of doing long-term large studies that are truly randomized. We can do short-term metabolic studies. The last piece is there is such a thing as a plant-based ketogenic diet. Dr. David Jenkins in Toronto, senior researcher in nutrition, described the glycemic index. About 10 years ago, wrote papers called Eco-Atkins, an Atkins-type diet, but eco meaning ecologically friendly, using plant-based foods. And he showed that a high-fat, still moderate carb diet, but using plants, helped reverse biomarkers. Wasn't long enough to talk about mortality. But you might want to do a plant-based diet if you're trying to get your weight down into a tuxedo. I think, or wedding dress, I think the most exciting data is actually another plant-based ketogenic plan, which has been developed by Dr. Walter Longo, PhD at the University of Southern California, who runs a biogerontology division. Dr. Longo is recognized as one of the top experts in the world on aging and longevity. He's described many fundamental biochemical pathways in yeast, mice, and humans because we conserve a lot of these nutrient sensing pathways and aging pathways. We have much in common with a yeast, which is pretty humbling. But Dr. Longo has developed something called FMD, fasting mimicking diets, where you take 5 days in a row and only 5 days, and you eat a reduced calorie, plant-based, low protein, low sugar, relatively high fat diet. It's fat because of olives and nuts, not because of bacon and butter. And he's shown tremendous biomarker improvement, weight loss improvement, but even more important, a response no other diet that I know of has shown a release of youthful stem cells from the bone marrow into the blood that rejuvenate, regenerate. I use this diet called fasting mimic diet in my cardiology clinic. I like it. One, it's plant-based. Two, it has tremendous, in fact, 20 years of scientific support. And number three, it's only 5 days a month. I don't think, and I know Dr. Longo agrees, that being ketotic every day of the month is very good for you. We weren't starving every day when we were cavemen and cavewomen. We were starving on occasion. So he's found that he can induce ketosis in 5 days, and you can return to a healthful diet for the rest of the month, 5 consecutive days, and you get this phenomenal response. So I'm not ruling out ketogenic diets, but I think the one that's being recommended that's akin to the Atkins diet is dangerous and should not be pursued.
Thank you very much.
Thank you.
We have someone here asking, actually it's one of my colleagues, Anne-Marie here. I think you already met. Tu veux-tu la poser? No, okay. She wants to know your opinion about supplementing in DHA, omega-3 long-chain fatty acids for heart health and general health.
Okay. Yeah, it's a great question. And 99% of the world agrees that an adequate supply of omega-3, well, I think everybody agrees that dietary omega-3 is a good goal. And in my world, that's plant-based, so that's flaxseed, chia seeds, that's hemp, that's walnuts, that's green leafy vegetables. It could be, if you're really into health, some of the algae, like blue-green algae, chlorella, spirulina, whether you take them as a capsule, whether you take them as a powder in your smoothie. Some people do a drink. All those are very rich sources of omega-3. I mean, for the rest of the world, there's, of course, salmon, sardine, herring, but we have that pressure to find super clean fish that aren't contaminated by pollutants and mercury and lead, heavy metals and such. Not lead, but mercury. In my clinic, because I run an advanced cardiac clinic in Detroit, Michigan, I measure blood levels of omega-3, and whether I'm dealing with plant-based patients, vegans, whether I'm dealing with the general population, many people are very low in the measured levels of omega-3. And either they're not eating foods from the animal world or the plant world, or maybe they're not absorbing them well, but they're not getting much EPA and DHA. And if you're low in EPA and DHA, you often see other blood work that results, like inflammation, C-reactive protein goes up, LDL becomes oxidized, which is considered a dangerous form of cholesterol, oxidized LDL cholesterol, and sometimes blood sugar, blood pressure, and such. So I encourage people to eat again, I would emphasize the plant-based sources that can become EPA and DHA, 2 tablespoons of ground flaxseed a day, walnuts more than other nuts like almonds, because walnuts are much richer in omega-3, green leafy vegetables that everybody should eat. But if you're going to supplement, that's where I get 99% of the world would say it's okay to supplement with EPA, DHA, which is either going to be sourced from fish like sardine and anchovy. You need to find good quality companies that you can trust have tested for mercury and eliminated it. They still don't usually test for the pollutants like PCBs and dioxin, which I worry about. Or nowadays, you can find many companies making algae-based, so not fish-based, algae-based, where we don't worry about mercury and PCBs and other pollutants. Algae-based capsules, they look just like a fish oil capsule, but they're algal oil capsule. They're very clean and pure. And it's now recommended, not everybody listening is a vegan diet eater, but those that eat totally vegan, as I have for 40 years, should be taking a small amount of algae-based EPA DHA a day, specifically about 250 milligrams. You eat your chia, you eat your flax, you eat your walnuts, but still to be sure that that all ends up in you having adequate blood amounts of omega-3, you take a supplement. I personally eat a lot of all those foods, but my blood level's low, so I take 2 capsules of algae-based omega-3 EPA DHA. There's about 1% of docs that think you shouldn't take EPA DHA, that you should let the body decide. Because when you take EPA and DHA, fish oil or algae oil, you're bypassing what happens with nature, because nature gives you, when you're eating chia and flax, it has to go through a series of steps to become EPA and DHA. But that's not an issue that's resolved or that I can resolve. But I would encourage people to eat those foods. And if you're never touching fish, maybe take a algae-based supplement. They should make omega-3 fortified wine, because that would take care of almost everything. There's a marketing idea for you people.
Thank you. Any other questions? I may have one quick, if you don't mind. What's
Sure.
on the Bulletproof coffee and the Bulletproof diet?
So today is Wednesday. 4 days from now, I'll be in San Francisco debating the man who founded the Bulletproof company, Dave Asprey, who is a friend of mine. I've been to several meetings with him. I've been on his podcast. I asked him to endorse my book on plant-based nutrition. He said, no, thank you. He's not a doctor. He's not a PhD. He's not a biochemist. He's actually a Silicon Valley entrepreneur who has studied health in great detail. And he has a theory that by eliminating junk food, processed food, we can all say that, and also, in his opinion, usually eliminating 100% whole grains because of the gluten. I'd say that's not scientific. Also, to eliminate many of the legumes, because legumes like lentils, peas, and beans theoretically have some, it's called anti-nutrients that might not be healthy, but I'd say that's not scientific. And by putting in lots of grass-fed, organic, free-range animal products, which was just recently studied in the last 2 weeks, and the study announced they're no better for the destruction of the environment than animal products factory farmed. They may be slightly healthier than factory farmed chicken, turkey, and meats, but for the environment, because when we run out of this planet, we don't have what's called planet B to go move to right now. So we better be talking about the environment every time we open our mouths and eat. But so then he came up with, as you know, his business started with his visit to Tibet, where he saw at very high altitude some of these people drinking tea with a pat of butter in it for a little energy. And he brought that back to Vancouver and California, said, I'm going to create a type of coffee. So he created a coffee bean that he sells as Bulletproof coffee beans. It's rather expensive coffee, but he checks that there's no fungus on it called mycotoxin, which traditional coffee makers say is not an issue. He says it's an issue. And he adds in butter and coconut oil in a blender. So you're basically drinking a saturated fat smoothie. And the original idea when I read about it 4 or 5 years ago and met him was that might cause you to be ketogenic and you might not want to eat again till 5 or 6 p.m. So it was almost like a fasting program. But I've gone to many conferences where people have Bulletproof coffee and their bacon and their eggs. And then at lunch, they have Bulletproof coffee and their bison and their lamb and their potatoes. And it doesn't seem like people are actually using it as part of a fasting play. So unfortunately, there's very limited medical data on it. I've been begging some of my colleagues, frankly, let's get 20 people that drink Bulletproof coffee. Remember, this is 8 ounces of coffee, usually 2 tablespoons of butter, a couple tablespoons of coconut oil, blend it up. So it's a lot of saturated fat containing products added to a beautiful cup of black coffee. I love black coffee. I don't like butter black coffee or coconut oil black coffee. But there is not that data. There is a case report or two of people who have had their cholesterol go up insane amounts in 30 days. Cholesterol 180 becoming 300 in 30 days. But there's so few reports that he's still out there being able to say, there's really no data this is harmful. In fact, it's very healthy. I'm quite certain it's harmful. It takes years to develop atherosclerosis. It takes years to develop the disease that causes a heart attack. I believe the Bulletproof coffee is accelerating that process, but I can't prove it. And until I have data, all I can say is buyer beware. And if you're drinking Bulletproof coffee, drink it very close to an emergency room. So if you start clutching your chest in distress, you're close.
Thanks so much. I have another question for you.
Good evening. I would like to have your view, please, on the opportunities that people may have by reversing some of their cardiovascular disease through fasting, and obviously follow or in combination appropriately with a plant-based diet.
Yeah, thank you. That's a extremely interesting question. And there were 2 parts I heard, and I'm glad you asked it. So I'm not aware of absolute data that is adopting, there's different kinds of fasting, 12 hours a day without eating, 14, 16, 18 hours a day without eating, or every other day without eating, or Dr. Longo, 5 days a month in a row, but it's 800 calories a day, so you actually do eat, but you eat reduced calories of a particular nutrient composition. I'm not aware of definitive data that it reverses atherosclerosis. There are some studies from the Mormon church group, the Latter-day Saints, that those that raise their hand and say, I practice fasting once a week, for example, which is pretty common in the Mormon religion, those that say that have less coronary artery disease. There are 2 publications in the cardiology literature that indicate that. Is that association? Is that causation? We don't know. There's a couple other studies like that. We do know that certain kinds of fasting, and particularly Dr. Walter Longo's research, lower blood pressure, lower cholesterol, lower inflammation, lower body fat, lower C-reactive protein. It should promote better arteries. But that's kind of like the ketogenic diet data. Biomarker isn't, vascular imaging data. So we don't know for sure. And that is the larger topic. Can heart disease be reversed? And my answer is, if I had heart disease, which I'm quite certain I don't, I've been tested, but I would try everything I could to reverse it because it's an aging process. It can dramatically shorten lifespan and quality of life. And it is scientifically possible to reverse atherosclerosis. We learned that long ago. There were studies in the 40s and the 50s, the 70s, 80s, 90s, and more recent studies that all indicate, just like a certain lifestyle brings on atherosclerosis, you just got to play your record backwards and you're likely to promote reversal of atherosclerosis. Now, there are genetic factors that you're not going to change by better exercise, managing stress, quitting smoking, and predominantly, like you said, adopting the only diet ever shown to reverse atherosclerosis, which is a plant-based diet without added oils, like Dr. Dean Ornish has described, Dr. Caldwell Esselstyn, even before that, Mr. Nathan Pritikin published data. So yes, it is. In my clinic, I use an ultrasound of the carotid artery to characterize how much plaque and to follow it. And I see dozens of examples in a short amount of time, 6 to 12 months, of actually reversing atherosclerosis. And it's not with Bulletproof coffee. It's with, 100% whole food, plant-based, clean diets, and hopefully some walking, exercise, stress management, and social support.
If I may ask you a follow-up on this, are you using coronary calcium testing as a way to monitor the improvement of the disease?
Yeah, I'm using it for the initial screen. As I mentioned a bit back, you have premature aging of your arteries because your coronary arteries are calcified, or you don't. You really, really would like to be a person with a coronary artery calcium score of 0. It indicates not only very low heart risk, but overall very youthful physiology. I'm not repeating it very often. There is a little data, very little data. You might cause it to actually go down. And that is my goal, but I don't like to repeat the radiation test, so I'm using ultrasound. But some patients ask, I want it repeated. Typically, the natural history in the science literature is, if your calcium score is 100 this year, it'll probably be 120 next year, maybe 135 the year after. It goes up. So if we just keep it at 100, that's a victory. If we can make it 80, that's amazing. But with diet alone, that's never been shown. Diet hasn't been shown to reduce. I practice an integrative form of cardiology, so I add certain vitamins that suggest that they can reverse the calcification, and I see it in the carotids routinely.
So is there you said there is not a lot of data on the effect of diet on the amount of calcium in the carotid?
That's true.
Okay, and do we have some data about previous diets on the, I don't know how to say that. So we don't know if someone that has been eating animal-based diet his or her whole life, does that person have more risk to have a lot of calcium in his artery?
Yeah, those, there are hundreds, if not thousands, of large studies using the coronary calcium CT scan as a marker of silent heart disease. And yes, all the risk factors, smoking, elevated cholesterol, blood sugar, blood pressure, and animal-based diets have all been correlated. Dietary measures clearly are correlated with having that. Now, there's many other factors. There can be genetic factors like this lipoprotein A level, homocysteine level, and such. We know that marathon runners develop more calcification in their arteries than people who have moderate exercise. People that sit all day long, people that have post-traumatic stress disorder, and many other kind of people that have autoimmune disorders like psoriasis, many other factors than what you eat alone. But nonetheless, yes. What we haven't had is a study where people have a calcium scan at baseline, and let's say 2 years later, some eat Mediterranean, some eat plant-based completely, and we've rechecked it. There hasn't yet been such a study.
Je veux savoir si c'est contre-indiqué.
Ouais.
Okay. My colleague want to know your opinion about calcium supplements in the context of coronary calcium. Is there a contraindication for some patients?
That's a good question, and the answer is maybe. I like to teach my patients that if they're supplementing with calcium, they don't need to supplement much more than 500 or 600 milligrams a day, because there's many easy sources of calcium, and I don't want them to do it by dairy products, because I think dairy is unnecessary, and the science says may actually be disease promoting. So, things like collard greens, nuts and seeds, other greens are great sources of calcium. And many of the plant milks, which have become so popular, almond milk, soy milk, rice milk, hemp milk, although I don't like rice milk because of a problem right now with arsenic in the rice supply. But anyways, those plant milks are often fortified with vitamin D and calcium. So yeah, I do limit them. And the literature has been, it's an issue, it's not an issue, it's not resolved. But since there's easy and healthy plant-based ways to get all the calcium you need, again, the data being that a country like the United States with a very high cow milk intake doesn't have any better rates of osteoporosis than countries with very low cow milk intake. So cow milk is not a path to avoid osteoporosis and fractures. Way you can avoid it is, weight-bearing exercise, natural plant-based sources of calcium, probably adequate sources of vitamin D. And I'm a big fan of a vitamin recently discovered in the last maybe 40 years called vitamin K2, which promotes calcification of bones and promotes the absence of calcification of arteries. So most of my patients take supplemental vitamin D